There may be no other time in someone's life when they are more silently judged by the general public than when they're pregnant. While pregnant people who have addictions are not just judged, they are shamed and stigmatized everywhere they go, and that needs to change. I'm Dr. Jill, and over the past 15 years, part of my practice has been providing care for pregnant people with addictions. Hopefully, you've watched my previous reels, and you know that when people have a severe addiction, they use substances throughout the day, not necessarily to get high, but just to feel normal and stay out of withdrawal. You also know that stigma drives people with addictions to hide their drug use and to not seek help when they need it. And you know that addictions are a health issue, not a moral failure. Well, none of that changes just because someone is pregnant. Now, if you generally agree with me on these things, but for some reason you draw the line when it comes to pregnancy, ask yourself why. Stigma and fear of judgment are big reasons why these folks sometimes avoid seeking care. Getting regular prenatal care is one of the most important factors for the health of both the pregnant person and their fetus, so your judgment does not help. Pregnancy can be a huge motivator for change in people. With welcomed pregnancies, people with addictions love that future baby just as much as anyone else. And with unwelcomed pregnancies, they require urgent help to get the care that's right for them as quickly as possible. But whatever they choose, they need your compassion. Pregnant people with addictions feel pressure to just stop everything cold turkey. Well, when someone has an addiction to opioids, going cold turkey is dangerous because it causes fetal distress and can cause preterm labor, miscarriage, and stillbirth. And going cold turkey off opioids puts the pregnant person themselves at a very high risk of overdose and death. Being on an opioid replacement medication like methadone or Suboxone is shown to improve outcomes and helps babies be born healthy. After the birth, they are monitored and often require some medications for a few weeks, but they do very well, especially when the parent continues on their opioid replacement medication and breastfeeds. The postpartum period is a really high-risk time for people with addictions, and sometimes people feel like all the supports they received while pregnant evaporate afterwards and no one cares anymore about them once the baby's born. Remember, if they're parenting their child and working hard to cut down on their substance use, that requires a lot of support. And if they're not parenting their child, if their child's been apprehended by child services, then they are dealing with the devastating trauma of having their much-loved child taken from them. Their risk of death in the year after giving birth is many times higher than in people without addictions, and they need intense supports. So yes, there are risks that come with pregnancies that involve addictions, and the complexities are more than I can outline here. But know that many babies are born healthy with people around them who love them very much. And if you feel a gut reaction of some sort when you see someone who's pregnant and struggling with addictions, turn that concern into positive action. Look into how you can provide non-judgmental support for pregnant people with addictions in your area. Bye, everyone.